Top of the morning, Dan and Amy writing the new Criterion over the weekend. Heather McDonald asked the question, compared to what? Compared to what? That's the question that should be the way every fear-mongering news story on coronavirus is framed. And she, goes through the comparisons, not just viruses like the flu, but also things like
what?
Like traffic fatalities in America.
Yeah. Or how many people died in DUI accidents yesterday or over the weekend. We still don't have one death in Illinois, by the way, which is great. I hope it remains that way.
And while we have reported in other countries, in particular, young people have gotten ill, severely ill, hospitalized. So they're not immune.
And we have of the 93 we have in Illinois, there is one child who's contracted the coronavirus.
In China, only one individual in the 10 to 19 age group died. But again, just pointing out that it's possible, but it's compared to what? And we've talked about pandemics of the past, not only the number of people infected, but the number of people who've perished. And you can't just look at this statically, to be fair. You have to look at what the potential is, what the exposure is. And so when Heather McDonald says the number of cases in most affected countries is paltry, as of today, some 127 countries had reported cases, but 48 of those countries had fewer than 10. More people have recovered from the virus than are still sick.
Right.
But, she says, the damage to people's livelihoods through the resulting economic contraction is real and widespread. The people who can least afford to lose jobs will be the hardest hit by the assault on tourism. Small entrepreneurs, whether in manufacturing or the service sector, will struggle to stay afloat. And the question is such economic damage, real economic damage, that's not easily to remedy after the fact, is it worth it? Including right now what we're projecting out in the energy sector with oil at $30 a barrel, which is a lot more bankruptcies, consolidations, than deaths from coronavirus. We'll see. But it's a question that's being raised, and it's being raised across the pond as well. Rupert Darwall, who's a strategy consultant and policy analyst, he's a former special advisor to the UK's Chancellor of the Exchequer and author of The Age of Global Warming, A History, as well as Green Tyranny, Exposing the Totalitarian Roots of the Climate Industrial Complex. Rupert Darwall, thanks for joining us. Appreciate it.
It's my pleasure, Dan and Amy.
Well, you take up sort of the same concern that Heather McDonald raises about policy making and the impact on business long term. That if you go down a particular road, that there is no walking back. You're talking about businesses going to net zero, which is meaning net zero carbon in terms of carbon emissions. She's talking about more short term with respect to what we're doing. Sacrificing economic vitality, at least supposedly on the altar of public health.
That's correct. But I do think with the coronavirus, you are seeing some people who are pushing the global warming agenda are comparing it to coronavirus. The thing about global warming is it happens very, very, very slowly, and we have masses of time to adapt to rising temperatures, which anyhow in the first instance help make our lives a bit better. Whereas something like a pandemic, the one thing we know is that it within weeks and months it spreads very quickly. So the parallels that some people want to draw, in my view, are wholly wrong and actually scaremongering. Climate change is not an existential crisis. It is not a planetary catastrophe, but we're told it is because they want to. It's a form of moral blackmail to harm the economy now for the sake of something that might happen or might not happen in a century's time.
And it's also a conversation about capitalism, isn't it? Talking now specifically about the opposition to the climate change hysterics and the net zero movement. This really is framed as capitalism versus a government-centric economy.
Well, if you look at the Intergovernmental Panel on Climate Change, the IPCC, produced a net zero report in 2018, and it was quite open. It said this is an opportunity for civilizational, societal transformation. And then it outlines policies which are essentially central planning on a global scale. And it says we need to transform supply and demand in the energy sector, the industrial sector, agriculture. They talk about an area even larger than the land area of the United States being transferred from pasture land. I mean, these are just huge, enormous top-down changes, and they are simply incompatible with capitalism. But there's another angle to this, which is whatever Bernie Sanders or Joe Biden wants to do in the US and whatever the European politicians want to do in the EU, neither the US or the EU are that important anymore in terms of global carbon dioxide emissions. But if you look at the countries of the West, they're about 26% of global CO2 emissions. So they'll just keep. What's happened is that since 2002, there's been an acceleration in the growth of emissions from the developing world, the major emerging economies. So it doesn't really matter what we do. That's why people like Joe Biden, and they seem to think that the United States lives under its own climate bubble. But a ton of CO2, it doesn't matter where it's emitted. It doesn't matter whether it's from the United States or it's in China or India. It has the same effect on the global climate.
Just to get a handle on coronavirus in the UK, especially after both the UK and Ireland were added to the list of countries in which there are travel restrictions from the U.S., President Trump naming them over the weekend. Give us a sense of how it's developing in the U.K. and what the government's response there has been.
Well, we're still at an early stage, but I think the authorities are quite rattled by the sudden surge in coronavirus fatalities, because we have a highly socialized system of healthcare, and the way healthcare is rationed in this country is essentially by the amount of capacity. And so we actually have a very our capacity, the capacity of the healthcare system to deal with it in this country is quite limited. So it's quite easy to foresee a situation where the healthcare system quickly becomes overwhelmed, and then you're into a very the awful things that we're seeing out of northern Italy, and indeed now Spain. So there's a real problem with the capacity of the healthcare system to deal with this pandemic.
Yeah, it's interesting because, of course, Bernie Sanders in this country is taking this as the opportunity to say, see, this is why we need Medicare for all, government-run healthcare like Canada, like the UK. Not according to British doctors. The Guardian reporting that in a survey of 1,600 British doctors, only 8 said the National Health Service is ready to cope with the pandemic. So that doesn't sound like the best and brightest in government, the central planners who have omniscience. Turns out that maybe they don't.
Well, when you look at what Singapore has been doing, which is quite a technocratic and authoritarian state, the quality of the public sector there is very high, and I'm loath to admit this, but it's simply in a different league to what we have in the United Kingdom, and dare I say it, parts of the United States. I mean, your state government in Illinois. Would you like them running your health care for you?
No, we would not.
God, please.
Or anything else for that matter. But yes, nothing as important as healthcare.
Well, what are they doing in Singapore that's so remarkable?
They had they built a specialized hospital for these kinds of virus because they had the experience of SARS 18 years ago or whatever. Mm-hmm. They therefore took steps to build a completely new facility dedicated to dealing with pandemics. And it's a very ordered society. So the government basically can tell people what to do, it can trace people and so forth. And that seems to have worked. And in South Korea, there's been mass testing and a much more proactive regime compared to the one we've had in certainly the United Kingdom, and I think actually it's fair to say most of Europe. And I think this goes to one of the points that socialists and liberals and Democrats that want the state to do more, they have to look at the competence of the state they're actually dealing with. And you know what I see from in Britain is the state's just not very good, and I think that's the case also in the United States. What's really good is the private sector and innovation and the markets, and businesses will find solutions to vaccines and testing and whatever. So you need to give businesses the signal to develop these, very strong signals to do that.
Well, and I'll tell you, this is also an opportunity to have a conversation about opportunity cost. And I go back to the British system. Britain already has more than 4.5 million citizens awaiting hospitalization. And we see this now too. We were just talking to a friend about his wife's surgery being postponed because they're making resource allocation decisions and trying to prioritize. So it turns out private sector, public sector rationing occurs. The question is dynamism and the ability to turn on a dime, the ability to make resource allocations decisions quickly. Have the agility of a speedboat and not a battleship. And in Britain, so the opportunity cost of those people waiting in line, they may be waiting in line some more, or there may be people who were next up and they're going to be put back in queue because there's all hands on deck to combat the coronavirus system that can't handle what it's already trying to handle now, this new exogenous threat.
Yeah, I think that there's a fundamental difference. With the British system, it's essentially a national triage service. So it basically ranks people in their need and their capacity to benefit from a medical intervention. Whereas in the United States, with a private insurance system, you have patients' rights. So the whole system is far more responsive to the patient. I know you have you have the intermediaries of the HMOs and so forth, but in the UK it's basically a top-down system with all the problems that entails. But Dan, you talk about opportunity costs, and we should come on to that with global warming, because one of I think the biggest things with global warming is that because we've been told now, for not just over the last 10 years, or it's not just Greta or whatever, Thunberg. It's not just the last 10 years. This stuff's been going on for 30 years, and we've been told global warming, climate change is the biggest threat facing civilization. But what we've actually seen, the thing that's actually trashed the economy and sent the markets into the biggest crash, virtually of all time, is not climate change. It's not global warming, because it's the threat of a pandemic. And when you say climate change is the most important existential issue, what you're doing is you're diverting people's attention from things that really can act like that. And I think we are actually seeing one of the huge costs of the obsession, and it is an obsession, particularly on the left, with climate change. It means that policymakers have taken their eye off the ball. Every December, there's a UN conference of about 30,000 people on climate change. And we have celebrities telling us if we don't change our ways, change the way we live, the planet is going to be destroyed. And it's this incessant propaganda the drumbeat of propaganda has really taken people's eye off the ball from from the real threats that can face civilization.
He is Rupert Darwall, strategy consultant and policy analyst, former special advisor to the UK's Chancellor of the Exchequer, author of The Age of Global Warming, as well as Green Tyranny. Rupert, thanks for joining us. Appreciate it.
My pleasure.
And he joined us on our turnkey.pro answer line.
Hear about the big stories of the day, then talk about them right here on Chicago's Morning Answer on AM 560. The Answer.
The Lou